Welcome to Dr. Farrukh podcast. Toothache, dental caries, and oral hygiene problems are there in our life. I am honored to welcome Dr. Aqib Mustafa, dental surgeon in Australia, and he will guide us regarding the dental hygiene and how to preserve our teeth for a longer duration. Kindly guide our audience that how to preserve our teeth starting from the childhood teeth and then the adult teeth.
So main thing is that we have to look after our teeth, and the best way to look after our teeth is to make sure that we're brushing twice a day, and we are also staying away from food that will damage the teeth, and usually it's more sugary foods or that can cause issues, things like chocolates, sweets, anything that might have sugar in it. So the best way are these two factors, making sure that you're keeping your hygiene up, and also staying away from things that can damage the teeth. The teeth start to erupt at a very young age. When a child is roughly 6 months old, their first set of baby teeth start to erupt until the age of roughly 2 or 3. And then at the age of around 6, that's when the adult teeth start to erupt with the first molars, until the age of 18, when we expect the wisdom teeth to erupt. So after the age of 18, we expect all the permanent teeth to be there, and once a permanent tooth is lost, there's unfortunately no replacement, which is why keeping the teeth clean and avoiding things that can damage the teeth is the best way to preserve our teeth for the remainder of our lives.
And generally, there is a culture to delay the dental appointments and to take those medicine which are already there at the home. So how shall we motivate people to come to dental surgeons early?
I think the best motivation is the fact that if you are seeing a dentist regularly, even when you don't have any pain or don't have any problem, then the best thing is that a dentist can spot anything that might look abnormal, or anything that they might find concerning. So even if there's a small cavity that's forming on the teeth that might not be causing any pain yet, at least they might be able to clean that tooth, clean the cavity, put a filling in, so that it doesn't cause you any problems in the future. And not only does that save you from feeling any pain or getting any discomfort, but also financially it's a lot more cheaper, and long-term wise it's a lot better for the teeth, because you've managed to clean the teeth out before it's caused any damage. Often people will start to feel pain and they'll start to take painkillers, they'll start to take antibiotics, which is good in the short term, but long-term wise it can actually make the infection more stronger. It can doesn't get rid of the problem, and as a result you've just delayed the time, and the more you delay the time, the less likely it is to get a successful outcome or get a good long-term prognosis. This is why the moment you start to feel any pain, usually that's a sign that the cavity has gotten too big or there is an infection growing. So the best thing to do is to go to the dentist, not to avoid going to see the dentist, but to go to the dentist and to sort out the issue before it gets worse.
Are there some considerations while buying toothbrush and toothpaste?
Yep, so there are a couple of different products out there now. So with a toothbrush, there's an electrical toothbrush, which is battery operated, or a manual toothbrush. So I am a big fan of an electrical toothbrush. I think it cleans your teeth very well, and it's very easy to use as well. So you just have to apply the toothbrush from one tooth to the other. A manual toothbrush does the same thing, but you just have to make sure that you have the right technique. So usually we recommend to go in circular motion, so that you can clean the teeth in 360 degrees. And usually I recommend to use a soft brush, because a harder brush can actually damage the teeth, it can weaken the teeth, and as a result that can lead to sensitivity and issues like that. And in terms of the toothpaste, I would recommend any toothpaste that has fluoride in it. So fluoride is an element that keeps our teeth strong and healthy. It prevents minerals from being lost from the tooth, and it preserves the outer layer of the tooth very well. So any toothpaste that has fluoride in it, that's something that I would recommend.
If tooth decay has gone to an extent that tooth needs to be removed, so what are the options available with the patients, like prosthesis or whatsoever?
So if we're in a situation where a tooth has to have an extraction, then there are a few options. So firstly, an option is to not do anything and not to replace the tooth. If you're finding that things are comfortable enough, it's not a cosmetic issue, you can't see the missing tooth from the front, and at the back, if you're not getting any issues while you're eating food or you're able to chew properly, then there is an argument to say that you don't need to have a replacement. But the best option would be a titanium implant. So an implant is basically a screw that's placed into the jaw, and basically it fuses with the bone, and then a tooth is screwed over the top. So this is quite a strong and long-term durable option, and it does what a tooth does very well. And the good thing about this option is that we don't have to touch the teeth next to it, whereas a dental bridge would be another option. In that case, we have to gain support from the teeth either side of the missing space, and in that we have to trim around the tooth. It can often weaken the tooth, and sometimes the tooth might not actually need touching. So usually I try to avoid a dental bridge because we often find with time food can get stuck underneath the bridge and it can cause potential issues. The other option would be a denture, so a plastic tooth that you put in and take out. So this is a removable prosthesis, and we find that it can lead to fungal issues sometimes if it's not being kept clean, and often people find that the denture doesn't stay stable as much, and they find that it can be a bit difficult to eat. But from a financial point of view, it's the cheapest option, and it can replace multiple teeth at once. So once a person gets used to the denture, then they find that it's very good, but it takes a bit of time, a bit of training to get used to it.
And kindly guide that, is scaling safe? Because after scaling some people get sensitivity, and why is it that most of the time we need to do scaling on the front lower teeth?
So scaling it can lead to sensitivity. Although it's considered quite safe, it doesn't wear away your teeth or cause any damage to the teeth. But what can happen is with time, you can have a buildup of bacteria that hardens and sticks onto the teeth. So basically we call that tartar or calculus. And the reason it forms around the lower front teeth more than any other area is because underneath the tongue we have the salivary ducts, and where saliva is produced. Saliva has minerals in it that can harden or calcify anything that is on the tooth. So it can make it really hard to the point that any brushing will not remove it. The only way you can remove that calculus buildup is by doing the scaling. Now, once we remove the calculus buildup, the teeth surface will get exposed, and as a result, you're more likely to feel sensitivity when you have hot and cold, which is very normal. And usually after 2 or 3 days, it goes away, but often people will think once they've had the scaling done that the teeth have been damaged, and that's why they're feeling pain or sensitivity, which is not the case. It's just the nerve is taking a bit of time to adjust to the fact that now it's a bit exposed. The other thing is, if you're doing scaling regularly, as we recommend every 6 months, then you're less likely to feel sensitivity because there's less calculus to remove, and it tends to be a lot more safer and more comfortable for the patient.
Are there some foods which tend to damage our teeth, or like soft drinks or any other thing? And what is the effect of extreme hot and cold food on our teeth?
Yep, a lot of sugary things will increase the bacteria in our mouth, and as a result that will increase acidity, and that can lead to cavities forming. Cigarette smoking is a very big problem. It causes not only issues with the teeth, but it also causes issues with the gums. We often find people that have smoke a lot, they have a lot of gum disease, and that can lead to swelling in the gums, pain, unable to eat properly, and also staining in the teeth, which obviously does not look nice. Otherwise, teas, coffees, although tea and coffee does not cause any cavities in our mouth, it can lead to not sensitivity, but it can lead to staining. And as a result, obviously, cosmetically, that can look unhealthy. Otherwise, hot and cold things, basically, our teeth can be quite temperature sensitive. The nerves in our teeth, they react a lot to the temperature change. So if you have something cold in your mouth and then very quickly you have something hot, then that can lead to severe sensitivity, and as a result that can lead to cracks in the teeth as well. So usually I try to avoid having something too hot or too cold, so that's something to be aware of. And as a result, it can lead to the teeth becoming hypersensitive, cracks forming in the teeth, which can cause pain when you're eating or having something hot or cold. And usually for that, no sensitive toothpaste can help. That can lead to having to get treatment done on your teeth. So it's something to avoid.
And coming to the dental cosmetology, the veneers, invisible braces or transparent aligners, how are they helpful, or whether there are some precautions?
There's a big trend going towards cosmetic dentistry, especially with veneers and things like that. And there's some countries that are very famous for providing treatments like this. For example, Turkey is well known for doing veneers and hair transplants and things like that. But usually what I tell my patients is that veneers is a lifelong process. It's not a quick fix, although at the start it might seem like a quick fix. But veneers is basically where we put a cover on the front of the teeth to make them look more whiter, to make the shape of the teeth look in a particular way. But the issue for that is sometimes we might have to cut a bit of the tooth structure from the front, and then we would have to stick the veneer at the front. So nothing lasts forever. With veneers, they can chip, they can break, they can fall off, they can get stained. And often we find that after maybe 10 years, we might need to replace the veneers, and then we might need to get more new veneers made. And then with age, the problem can keep getting worse and worse, to the point that we might need to do crowns, basically keep adjusting the cosmetics of the teeth. So usually I strongly recommend if a person was to get braces or to get clear aligners, to move the teeth into the correct position. And that way it's more natural. We don't have to cut any of the tooth structure. It's a temporary sort of thing, but it takes a longer time to see the result. Sometimes it can take a year or 2 years, whereas with the veneers, they can just take 2 weeks to see the result. But as I said, veneers can be a lifetime process. But clear aligners, like Invisalign, for example, they're a good substitution for braces. Instead of having a wire or brackets to pull the teeth, we have preformed aligners or a set of plastics that will push the teeth into a set position. And we find this to be quite a useful treatment option, a good success rate. And the best thing about it is you can take the aligners off to eat and to brush your teeth, and we find that it's a lot more hygienic as well. But the other issue is cooperation. Sometimes a patient who's going through the treatment, they might lose their aligner, or they might not wear the aligner long enough to see the result, whereas with braces, the advantage is that it's fixed, you can't take it off. So that's one advantage that braces has. But in saying that, I think the general trend is that more and more people will prefer to use aligners.
And you are lucky enough to be in a profession which you have chosen, and you wanted to become a dentist. So what is the story behind? How did you select?
Becoming a dentist? Yeah, so it's an interesting story, because when I was 12 or 13 years old, my mother picked me up from school, and she told me that she has a dental appointment to go to. So I was a bit upset, because I wanted to go home and play games and just relax after school. But I had to go with my mom to her dental appointment, and she gave me her phone to play games with. But instead of playing the games, I was more interested in seeing what the dentist was doing. He was using different tools, using UV light, and I found it so fascinating watching the dentist, because I was thinking, why is he using so many tools to to fix a tooth, you know, it's just a tooth. But from there, I got a bit of, I developed an interest, and I just felt that I wanted to become a dentist from that point on. My parents always encouraged me to think about medicine, but I was always very interested in dentistry from that point.
And you have been to very many countries in this young age. So, would you like to share any experience, any memory with us?
Yes, so alhamdulillah, I've been quite lucky to have traveled a fair bit. But one of the countries that's very close to my heart, apart from Pakistan and perhaps where I live in Australia, is Brunei Darussalam. So Brunei is a small country next to Malaysia, Indonesia, Singapore, and I did all my schooling in Brunei. So the Brunei has a kingdom, a Sultan of Brunei, who at one point was the richest man in the world. So he's well known, world famous. And I was lucky enough to go to school with one of his sons. We were in the same class, so we developed a good friendship. So I used to be able to go to the prince's palace to play with the prince, and alhamdulillah, this was a very unique situation. It's not often anyone gets to spend time with a royal family, so it's a very special memory that I have, and something that I cherish as well.
We are highly thankful to you for your fruitful and useful insight and valuable information. And believe me, if we are able to act on this advice, our life will become better.